Hey everybody, in this video I'm going to talk about 3 common mistakes doctors make when communicating with patients. In healthcare, communication is everything, and it's easy to forget this in the hectic everyday medical environment. Think about it, any healthcare professional can do the most amazing job imaginable, but if the communication to the patient and family is suboptimal, it counts for little. Here are 3 mistakes that doctors make then when communicating. And in fact, these could apply to any medical professional, whether it's a nurse or physical therapist. Number 1, looking visibly in a hurry. I get it, hospitals especially are very busy environments. There are always 101 things to do and unexpected emergencies come up all the time. You are going to be busy, but never forget that the majority of our communication, some estimates suggest as high as 90%, is nonverbal. Are you coming across flustered and in a hurry? People pick up on that in a second. Take a deep breath, don't make any rapid movements, slow down, sit down whenever you can. And don't talk too fast. Number 2, listen. Remember the phrase, if speaking is silver, then listening is gold. Your job as a doctor is not to barge in and give your opinion. You are in the privileged position of people sharing their innermost secrets and concerns with you. They trust you. Studies suggest the average doctor interrupts their patient after only 10 seconds of talking. Again, I get that you need to be focused and your time is limited, but don't forget that it's your duty to listen as attentively as possible. Give the patient time to speak. Use open-ended questions and active listening techniques. See yourself as the listener-in-chief, not the speaker-in-chief. Number 3, avoid using technical medical jargon. I never cease to be amazed when I hear even experienced doctors talking to patients and their families who have little medical knowledge as if they are professors of medicine. See it all the time. Most people don't have detailed medical knowledge and appreciate you putting things in easy to understand terms and concepts. If you have to use a term like ejection fraction or DVT, explain what these mean. Never assume anything in terms of what people understand. Actually, it's always best to confirm with them both before and after how much they understand about what's going on. So these are 3 important areas of communication where doctors frequently fall short. Again, they are so easy to forget as our days are busy and we run through long lists of patients. Those few minutes we get to spend with patients, they may have been waiting hours for, and patients will often remember every detail of their interaction with you. Make that time worthy. I frequently have to keep reminding myself of these things too, and often take a deep breath before I enter the patient's room and remember what a privilege it is to be the doctor. Make your patient the absolute center of your world for those few minutes. And never forget, in healthcare, communication is everything. Thanks very much for listening. I hope you've enjoyed this video. Please do go ahead and subscribe to my YouTube channel for more videos. See you next time.